as Estrogen Esterified.
And today we'll be talking about my drug name, my drug classification, my pregnancy category, the mechanism of action, the pharmacokinetics, the indications and the contraindications, the side and adverse effects, and lastly, the nursing responsibilities.
And I hope you will learn something about me.
So I was approved by the Food and Drug Administration, or the FDA, last 1978. So for the generic name is Estrogen Esterified. My brand names are, there are many, Menes, Estrotab, Estrogen, and Esterified. And for my chemical name, there's no chemical name specified for that drug, but it is primarily consists of sodium estrone sulfate and sodium equine sulfate.
So my drug classification is that in therapeutic I am classified as estrogen replacement and anti-neoplastic, while in pharmacologic I am classified as estrogen.
And for my pregnancy category, there is X. Pregnancy category is X because there is no indication for estrogen esterified in pregnancy and should not be used during pregnancy because of increased risk for fatal abnormalities.
So my mechanism of action is that through a negative feedback mechanism, I modulate the anterior pituitary gland in the secretion of gonadotropins, luteinizing hormone, and follicle-stimulating hormone. I am also an estrogen replacement, reduces elevated level of the hormones, and I am responsible in stimulating the growth and development of female characteristic, thickening of the endometrial lining, and shaping of the body contours and the skeleton.
For the pharmacokinetics, let's start off with absorption. I am readily absorbed after oral administration. There were three kinds of estrogen: the estradiol, the estriol, and the estrone. The higher concentrations of estrone are achieved with oral administration, whereas higher concentrations of estradiol are achieved after percutaneous absorption. And for the distribution, estrogens are widely distributed in the body and are generally found in higher concentration in the sex hormone target organs. And for the metabolism, this transformation takes place mainly in the liver. Estradiol is converted reversibly to estrogen, which both can be converted to estriol, which is the major urinary metabolite, basically found in the urine. And for the excretion, estradiol, estriol, and estrone are excreted in the urine.
My indication is that I am indicated to replace estrogen in women with ovarian failure or other conditions that causes a lack of natural estrogen in the body. I am also indicated for the treatment of symptoms of breast cancer in both men and women. And in men, I can be used for the treatment of advanced prostate cancer, while in female for hypergonadism, castration, primary ovarian failure, breast cancer in appropriately selected women and men with metastatic disease. I am also a treatment of moderate to severe symptoms of vulvar and vaginal atrophy associated with the menopause, and osteoporosis prevention, atrophic vaginitis, and atrophic urethritis. And I am also palliative treatment of advanced inoperable prostatic cancer.
Next, for the contraindications. I should not be used in women with any of the following conditions. We have 8. First, number 1, hypersensitivity to estrogens or any component of the formulation. Number 2, undiagnosed abnormal genital bleeding. Number 3, known suspected or history of cancer of the breast except in appropriately selected patients being treated for metastatic disease. Number 4, known or suspected estrogen-dependent neoplasia. So when we say neoplasia, this is a uncontrolled growth of cell. Number 5, active deep vein thrombosis, pulmonary embolism, or history of these conditions. Number 6, active or recent arterial thromboembolic disease. Number 7, hepatic dysfunction or disease, because the liver is an important role during biotransformation of me. And lastly, known or suspected pregnancy. Again, pregnancy category X.
My side and adverse effect first in genitourinary system is that eye breakthrough in spotting, bleeding, change in menstrual flow, dysmenorrhea, vaginal candidiasis, increase in size of uterine fibromata, change in cervical secretion and the degree of cervical secretion, and premenstrual-like syndrome. While in central nervous system is that chorea, dementia, dizziness, exacerbation of epilepsy, headache, irritability, depression, migraine, and nervousness. While in endocrine system and metabolic, my side and adverse effect are change in libido, exacerbation of porphyria, fibrocystic breast changes, galactorrhea, menstrual disease, premenstrual-like syndrome, weight gain and weight loss. In gastrointestinal are bloating, abdominal cramps, carbohydrate intolerance, gallbladder disease, nausea, pancreatitis, and vomiting. While in hematologic and oncologic is that endometrial carcinoma, malignant neoplasm of breast, malignant neoplasm of ovary, and hemorrhagic eruption. While in neuromuscular and skeletal system is that leg cramps and arthralgia, while in respiratory system is exacerbation of asthma. In cardiovascular system are deep and superficial venous thrombosis, pulmonary embolism, thrombophlebitis, myocardial infarction, stroke, increase in blood pressure, while in miscellaneous are increase or decrease in weight, reduced carbohydrate tolerance, aggravation of porphyria, edema, and leg cramps.
Now for the last part, the nursing responsibilities. So nurses should know what to do before, during, and after administering me. Before, nurses should assess the appropriateness of the medication practices by considering the patient, the drug, me, and the environment. Also, nurses should always be cautious and know the contraindications to prevent any untoward complications. It is also important to discuss the patient about the drug being administered and gain verbal consent in administering it. And lastly, administer me!
So, during the medication administration, the nurse will position the patient comfortably to swallow the medicine. Second is taken the required dose into a medicine pod. Then third is monitoring the report breakthrough vaginal bleeding. Fourth is assess for relief of menopausal symptoms. Fifth is, of course, for the laboratory test and monitor serum phosphatase levels of prostate cancer. And after the administration of medication, the nurse should notify physician of intermittent breakthrough bleeding, spotting, bleeding, or unexplained and sudden pain. Second is check client understanding of the drug's action by accurately describing drug side effects and precautions.
And it is also important for nurses to establish a risk management plan to ensure that any potential risks are directly recognized and minimized.
So that was all about me, Estrogen Esterified.
I hope you've learned something about the story of my life.
And hopefully you're able to understand me very well. And thank you for watching.
So, God bless. Bye-bye.